Back on the campaign trail, this after testing positive for coronavirus and a brief hospitalization. But over the weekend, President Donald Trump held a mini rally at the White House Rose Garden.
U.S. public health services have very clear criteria in place for what represents the release of an individual from what might be isolation due to being infected. And the criteria in the US, Maria May outlined them, are very clear. From W.H.O's perspective, we allow both testing and duration of a number of days since the onset of symptoms. Both approaches are used by WHO or offered to our member states as mechanisms. I believe, Maria, it's 10 days from the onset of symptoms and plus 3 days from the onset of the last, or the cessation of the last symptoms. And again, all countries have adapted that according to their national protocols, and therefore we wouldn't comment on whether any specific individual meets the requirements of their national protocol.
We work with countries all over the world, we work with labs all over the world to look at when people test positive using PCR testing, but also looking at virus isolation from those individuals. And there are a handful of studies that have been underway. We've outlined our understanding of the science in a scientific brief on this, which is on our website. And we are continuing to work with labs who are following patients and individuals over time. And so this is a body of work that is very important for us. We work with our counterparts in the U.S. as well.
The organization says it will publish guidelines for member states.
Elections do many things. They're an essential part of our lives, and they're absolutely central to how many societies live, survive and thrive. They're very important parts of the cycle of life. However, they do tend to bring people together. We've seen many examples over the last 9 months where elections have actually been held very safely and with appropriate measures, and have been straightforward enough to manage and implement. It takes effort. We've worked very closely in the past in the same way we've done for all types of mass gatherings, and we've worked on a risk management approach. You cannot reduce the risk to zero, but what you can do is identify and manage those risks, especially where in-person voting is the choice of the country. We don't specify to any country what the proper choice is for the type of election they need to run. That is based on their own risk assessment. But we do offer them advice on how to reduce those risks if in-person elections are the way forward. And in fact, we're working right now on finalising specific guidance for countries who choose in-person elections, learning from the last 8-9 months as to what has worked in those circumstances, and we'll be issuing that guidance in the coming days.
The WHO has called on member countries to comply with COVID-19 protocols. Sophie Mkwena, SABC News, Johannesburg.